The Senate Committee on Health Policy is called to order. Will the clerk please call the roll?
Chairman Hertel?
Yes, or
Senator-
here, sorry.
Senator Santana? Senator Voino? Senator Cherry? Senator Kleinfeld? Senator Geis? Senator Weber?
Here.
Senator Hauk?
Here.
Senator Heisinger? Senator Runstead? Mr. Chairman, you have 8 members present. There is a quorum.
Thank you, Madam Clerk. I will entertain a motion to adopt the September 10th, 2025 committee meeting minutes. So moved by Senator Woino. Without objection, the minutes are adopted, and I will make a motion to excuse absent members, and seeing no objection, absent members are excused. Today, we're going to take testimony and some presentations regarding Senate Resolution 81 that is focused on calling on Congress to renew the tax credits for plans purchased on the healthcare exchange for the Affordable Care Act. I think we are all seeing this discussion play out at a national level and how it will directly impact families all across the country. People will see their premiums or out-of-pocket costs double, triple in some instances, and those letters are going out now. We're seeing families that are understanding the impact of this, who are already struggling with increased costs from things like groceries, prescription medicines, and everything they need to pay for on a day-to-day basis. This will just compound those issues and make it harder for them to get by. We've seen in recent years that, we have seen an increased enrollment on the exchange, which is a good thing. More people are finding out that they can have affordable access to health insurance here in the state of Michigan. It has promoted more access to care for individuals, specifically preventative care, so that they can get the medical treatments that they need. But this, without the renewal of these tax credits at a federal level, will cause thousands to lose access to affordable health insurance, therefore losing access to that care that they need. It will also change our insurance pools because younger, healthier people who buy plans on the exchange today will be less likely to purchase those plans going into the future because they will not be able to afford them. And when that happens, costs will go up for everybody, as we will see insurers here in the state forced to cover some of the sickest lives in the state without having some of those healthier lives to balance out that cost. And so we want to understand today the exact impact that these decisions at the federal level will have directly here in Michigan for patients and for folks that buy their insurance on the exchange as well. So we will begin with a presentation from DIFS. I'll call up Joe Sullivan, the Director of Innovation and Research, and Jenny Gies, Legislative Liaison Manager, Office of Innovation and Research as well. Thank you for being here today.
Good afternoon. Thank you for the opportunity to speak today about the impact of recent federal changes to the Michigan health insurance marketplace. Chair Hertel asked us to give an overview of the health insurance marketplace, DIF's role, and related consumer protections. We will detail efforts to ensure a stable healthcare marketplace while maintaining the most affordable and quality health care possible for Michigan residents. A little bit about DIF's authority. DIFS works to ensure the safety and soundness of the state's insurance industry. In addition to the Michigan Insurance Code, 19 other primary state statutes govern the insurance work we do. There are also several dozen federal statutes that govern our operations, such as the ACA, HIPAA, COBRA. However, Medicaid, Medicare, and self-insured employer plans are primarily regulated by the federal government. At the program level, as you are all aware, Medicaid is also overseen by DHHS. How the health insurance marketplace was established by the ACA and is a federal operated insurance marketplace where individuals and families can purchase and compare health plans. These plans cover 10 essential health benefits, including doctor services, inpatient, outpatient hospital care, prescription drug coverage, pregnancy and childbirth, mental health services, and more. And some plans cover more services. The plans also provide consumer protections like requiring coverage for those pre-existing conditions, requiring coverage for dependents up to 26, and prohibiting annual lifetime limits. DIFS is responsible for recommending the certification of qualified health plans that provide essential health benefits, follow established limits on cost sharing, and meet other requirements under the ACA. The marketplace only includes individual plans, and for plan year 2025, Michigan had over 530,000 Michiganders enrolled in the individual market, which is primarily what we'll be discussing today. I'll kick it over now to Joseph.
Thanks again for the opportunity. So I'm going to start with the DIFS rate-making process. So the DIFS Office of Rates and Forms is responsible for reviewing insurance policy rates and forms for compliance with state and federal statutory requirements. DIFS does not set the rates, rather companies are responsible for setting the rates for their policies. But these rates must comply with Michigan law and must not be unreasonable and must be actuarially justified and not unfairly discriminatory or excessive. This year, due to uncertainty and evolving guidance at the federal level, states had to find a way to be nimble in their rate and filing review procedures while still meeting the CMS deadlines, all without compromising our duty to thoroughly evaluate each proposed rate increase. The timeline and process for filing insurance rates are typically a busy time for our office. This year's timeline has been unprecedented. Due to uncertainty about possible congressional action related to cost-sharing reductions, DIFS initially required insurers to file 2 sets of rates. We work closely with health insurers through the rate review process to navigate various changes and deadlines. As always, we use outside actuaries in our review of rate filings to ensure that any increase is justified and that consumers are protected. Due to the requirements on insurers to submit 2 sets of rates, and other necessary changes that were atypical for a filing year, DIFS had a significantly increased workload and expenses for actuarial reviews with its review of filings this year. DIFS will publish the plan year 2026 final rate report on the November 1st start of open enrollment. This report will be posted on our website and I'll provide a detailed summary of those rates. Next, I want to talk a little bit about the impact to health insurers in our state. Because of the volatility this year, CMS announced a deadline of September 25th for issuers to withdraw plans. There are usually changes to plan offerings, but as seen in many other states, the volatility caused by the inaction on enhanced premium tax credits and marketplace reforms have led to a variety of types of withdrawals, including issuers declining to offer certain plan types or remain in certain areas of the state, some withdrawals from just the marketplace or withdrawals from the individual market as a whole. If an issuer exits the individual or group market entirely, there's a 5-year market reentry ban. Issuers generally try to avoid this, which is a good thing for market competition. Historically, Michigan has had a robust insurance marketplace with more plans offered than in most states, allowing for more competition and consumer choice. Next, I want to give a little bit of a background on the advanced premium tax credits, which have played a critical role in making health care on the individual marketplace affordable for consumers. From the outset of the ACA, the federal subsidy was designed to help eligible individuals and families with low to moderate incomes pay for health insurance purchased through the marketplace. Eligibility and the amount of the tax credit are based on an individual's estimated annual household income, household size, and geographic location. Based on an individual's income estimate, the marketplace will send the APTC directly to the individual's insurance company each month. The insurance company then bills the consumer for the remaining premium amount. The credits are a mechanism to reduce health insurance costs for those who don't qualify for Medicaid or Medicare, don't have employer-based insurance, and many are consumers who may not have purchased health insurance otherwise. Next, I'll talk about the enhanced advanced premium tax credits, which were established by the American Rescue Plan Act of 2021 and extended through 2025 by the Inflation Reduction Act. These enhanced credits expanded eligibility and increased the amount of financial assistance available. For plan year 25, a record of over 530,000 Michigan residents were enrolled in a marketplace health insurance plan, and the majority of those consumers were able to purchase this coverage due to the availability of enhanced credits. For 2024, nearly 90% of enrollees qualified for a subsidy, saving an average of more than $380 per month. This figure includes APTCs as well as enhanced APTCs. Next, I want to talk about the impact of those subsidies. Failing to extend the enhanced tax credits beyond the end of 2025 will impact marketplace consumers' out-of-pocket costs. It will have the biggest impact on those who use these tax credits to obtain affordable coverage, but also the entire market as a whole. If Congress sunsets the enhanced tax credits beginning in 2026, premiums will increase by over 75% on average, according to an analysis from KFF, a nonpartisan health policy research group. But some consumers could see much higher increases based on their location, age, income, and other variables. In Michigan, an estimated 40,000 Michigan families currently enrolled in coverage through healthcare.gov will no longer receive any premium tax credits. Next, I could provide an example, which may be helpful. According to the Center for Budget and Priorities, a 60-year-old couple in Michigan making $82,000 a year will see their monthly premium go from $580 a month to $1,710 a month. So that's over $1,000 increase a month. As a result, many residents may risk going without health insurance entirely. These individuals may still get injured or sick and will need to seek care somewhere, even if they're not insured. The expiration of the enhanced subsidies will also increase costs when a pool of relatively young and healthy individuals decide not to purchase coverage in the marketplace. This would worsen the risk pool and increase premiums for both subsidized and unsubsidized consumers, and potentially lead to more consumers and insurance carriers considering leaving the marketplace as a result. Next, I'm going to turn it over to Jenny to close us out and provide some action steps that you all can take.
Yeah, so what should your constituents know and what can they do? This year, due to new CMS guidance, information about increased monthly premiums for 2026 may not be included in notices insurers send to their current customers. Consumers may not know it, may not notice it, like any changes, until their first bill. On November 1st, constituents can log into their marketplace accounts and review their new premium amount. Residents should gather important information and income verification documents, take time to shop around and compare health insurance plans, and keep track of the shortened deadlines and new requirements. Residents who utilize healthcare.gov for their health insurance should be aware of the following changes. Health insurance marketplace policyholders may need to be prepared to update their income and other information quickly, as the amount of time allowed to resolve data discrepancies was shortened from 150 days to 90 days. If consumers automatically re-enroll, they should log into healthcare.gov long before the December 15th, 2025, and review their information during open enrollment, especially since information about monthly premiums for 2026 may not be included in this year's notices that is sent to them. For new enrollees, including those who enroll outside the open enrollment due to a life event or income change, may need to prove eligibility before they can receive subsidies. Looking ahead to next year, open enrollment will be shortened by a month, ending December 15th, 2026, rather than January 15th, 2027. So what is DIFS doing to get the word out? Every year, DIFS works diligently to get the word out about open enrollment and what actions consumers need to take. The department has updated its health insurance website at michigan.gov/health insurance with resources to get covered during open enrollment. We're updating the department's on-hold messaging system with open enrollment information. We've been implementing earned media strategies that emphasize the importance of open enrollment and contacting DIFS for more resources. We will also share a legislator and stakeholder media toolkit to help you communicate with your constituents, including sample social media graphics. Furthermore, we'll be offering online open enrollment webinars, and we would be happy to partner with you on any outreach events. In addition, DIFS Office of Consumer Services provides consumer information and assists consumers with questions and complaints. This includes connecting consumers with all available resources, including answering questions through our live call center and connecting people to health insurance navigators who will help them assess their options, sign up, and stay enrolled in the marketplace plan. The office also oversees the DIFS call center, which serves as the initial point of contact for all incoming calls and visitors, which many of you, I believe, have already have used. Our call center has representatives who take live calls Monday through Friday, 8 to 5 p.m., and can call 877-999-6442 or online. per Governor Whitmer's Executive Directive 2025-6, DIFS is proactively communicating updated information to consumers so that they are prepared to make informed insurance decisions during the open enrollment period. Our approach has been to protect consumers to the greatest extent by balancing a competitive health insurance market while ensuring any rate increases are actuarially justified. We appreciate the opportunity to come before you today to share this information, and we look forward to continued collaboration in protecting Michigan consumers. Happy to take any questions.
Thank you both for being here and for all the work you've done to at least help folks understand and deal with problems as they arise, as these changes occur. I think unfortunately, and listen to your testimony, the reality is though that from the decision that is being made at the federal level to not renew these to this point, it's created a lot of uncertainty here in the state, but the ultimate effect is it will increase costs to families who currently purchase plans on the exchange and have these tax credits. I think we've seen this in other states and nationally. We've seen some large national insurers simply say that they will not even sell plans on the exchange going forward because of this tax credit going away. Do we have plans here in the state of Michigan that you were able to speak about today that will be leaving the exchange?
Yeah, on that, I can note that our comprehensive rate report, which is a federal requirement and also a boilerplate requirement in Michigan budget, will be out next week. It'll detail all of the plan changes in the state that you're experiencing. But yeah, in short, that's correct. I think companies have had to face difficult decisions and reevaluate their position in the market and determine whether or not it would be beneficial for them to stay in the state, which means that, almost 200,000 people are potentially going to be losing their insurer, and they need to be crosswalked onto different insurance plans. And it's been a volatile and interesting process, to say the least. But yes, you're correct.
And I would argue that as that happens, we see less competition occur, which changes the dynamics on the exchange as well. We had some folks that would qualify, depending on where they are within that sliding scale for the tax credits, for $5 or $10 plans. They could no longer qualify for some of those plans, and it changes the ability for insurers to be able to offer different products. And as less are insuring folks here in the state, that lack of competition only moves us in the wrong direction. And I would venture to guess that we're seeing the beginning of it this year with the uncertainty, and this being the first year in a long time these credits will not be available. But as we go forward and those risk pools change, this only gets worse over time as it's more unaffordable for people here in the state and across the country to afford some of those plans. Senator Cherry.
Thank you, Chair, and thank you for the presentation. When I was listening to you, you talked about how the enhanced premium tax credit increased eligibility for the tax credit. Can you clarify? I might have missed it. It got enhanced. What was previous eligibility, and then who became eligible for tax credits with the enhanced provisions?
So the enhanced tax credits, there's a calculation that goes in. It's income-based. It's based on a variety of variables that determine whether, like household size, a number of things. And then a consumer would be eligible for an enhanced credit, which would be, higher dollar amount, which would provide that individual more cost savings. The intent is to try to get those individuals on the market. You're typically looking at people that don't qualify for Medicaid. They make too much money to qualify for Medicaid. So you're trying to incentivize those folks. So it's in addition to the APTCs, you have the enhanced APTCs, which is essentially a greater subsidy that only certain folks qualify for.
So what I thought I heard you say in your testimony is that, so eligibility is based on a percentage of federal poverty level.
Correct.
But that it enhanced eligibility, like it increased eligibility. What did it increase from into?
The enhanced it was an enhancement in the dollar amount that the consumer was receiving based on federal poverty level and other variables, which is what we said in our testimony.
Okay, so there's no expanded eligibility. It was just increased subsidy for those who are already eligible.
Yes, that's my understanding.
Thank you. Seeing no further questions, appreciate the information today. Thank you for all you're doing. Next, I will call up Dominic Pallone and Christine Shear from the Michigan Association of Health Plans. Thank you for being with us today.
Thank you for having us. Good afternoon, Chairman Hertel and members of the committee. My name is Christine Shearer. I'm Deputy Director of Legislation and Advocacy for the Michigan Association of Health Plans. MAHP represents 10 health plans covering nearly 4.1 million Michigan residents through the Medicaid, Medicare, and commercial products, as well as 45 business affiliates. Joining me today is Dominic Pallone, MAHP's Executive Director. On behalf of our 10-member health plans, I want to thank you for inviting our input on this important discussion regarding enhanced premium tax credits. MAHP members continue to lead the nation in expanding access to effective, affordable, and equitable health care. Policy discussions like today are essential in ensuring consumers remain informed about health care access and affordability. We especially appreciate Chairman Hertel's leadership and his measured, thoughtful approach to this critical issue. He, his office, and caucus policy staff have consistently sought input, shared ideas, and engaged in constructive dialogue with our member plans. MAHP represents a diverse group of health insurance providers, serving individuals and families across the state and nationally. Our association is uniquely positioned to share insights and experiences regarding the implications of expiring EPTCs. In 2024, more than 24 million Americans selected health care coverage through the Affordable Care Act marketplace, the largest number ever to choose coverage through an open marketplace of competing health plans. We are proud to stand with national and state partners, including the American Hospital Association, the American Medical Association, the Federation of American Hospitals, America's Health Insurance Plan, American Academy of Family Physicians, the Michigan State Medical Society, the Michigan Health and Hospital Association, and the Michigan Primary Care Association in urging Congress to make enhanced premium tax credits permanent. EPTCs directly reduce the cost of coverage for consumers and lower average premiums across the marketplace. In Michigan alone, more than 500,000 residents enrolled in the marketplace plans last year, with approximately 90%, about 450,000 people receiving federal tax credits that lowered their monthly premiums, making quality, comprehensive coverage attainable. If these tax credits are allowed to expire, the impact will be immediate and severe. According to the Kaiser Family Foundation, premiums in the individual marketplace could increase by as much as 114%. Nearly 100,000 Michiganders will likely lose coverage altogether, driving up the state's uninsured rate and straining healthcare providers. As open enrollment begins in just a few weeks, nearly 500,000 Michigan residents face greater uncertainty rather than ever before. The potential loss of federal tax credits, combined with rising medical inflation and escalating prescription drug costs, could result in some of the steepest premium increase seen in nearly 2 decades. I will now turn it over to Dominic Pallone, our Executive Director, to discuss possible policy solutions.
Thank you, Christine, and thank you, Chairman Hertel and members of the committee. Again, appreciate the opportunity to be invited here to talk about this important issue, and such an important issue as healthcare affordability is for our citizens. Affordable health insurance is at the forefront of everyone's mind, not only here in Michigan, but nationally. Rising healthcare premiums attributed to higher prescription drug costs, elevated acuity of claims, or the cost of those claims, and then coupled with the potential loss of these enhanced consumer tax credits will leave employers and customers with sticker shock as we head into next year. It's more important than ever that the state and federal policymakers consider policy solutions to help make healthcare more affordable. These trends underscore the need for proactive policy solutions. Our association prides itself in being a resource to policymakers on this topic, and our unique membership of state and national health plans have identified various policy ideas and best practices from other states that can help health insurance become more affordable in Michigan. I've attached some background information to the written testimony that we've submitted here today on how to make healthcare more affordable in Michigan. And this document contains about a dozen different policy solutions that policymakers could consider and that we would encourage a conversation around. I want to share just a couple of ideas with this committee here and would implore everyone to think big and explore ways in which we can stabilize the individual market together. One of these topics to bring your attention to is that some states have allowed individuals with incomes just above the Medicaid eligibility threshold to purchase Medicaid-like insurance policies. Policymakers could explore legislation here in Michigan or similar to legislation passed in other states to create a basic health program. Some of those other states that have gone down this path include Oregon, New York, and Minnesota. This would help those who might be left unable to afford the individual marketplace insurance today. And then the other thing I'll note here is that nearly a decade ago, the federal government expanded access to association health plans, allowing small businesses, self-employed individuals, and independent contractors to purchase health plans in the large group or at lower costs. Michigan could codify an upcoming federal rule once issued to preserve the expanded scope of accessibility of association health plans in Michigan. Doing so would give small businesses more flexibility to provide lower cost insurance options for their employees. And as Christine mentioned, and just to close here, I again want to thank the chairman, staff for the committee, and all of the committee members themselves for their willingness to take on this difficult issue here today. Certainly, we, as Christine noted in her testimony, we very much agree with the importance that Congress should act. There is still time for Congress to act on extending permanently the enhanced premium tax credits that are available to many on the individual market today. Thank you.
Thank you very much. One of the things we've heard at the federal level is that if Congress doesn't act in pretty short order, an open enrollment begins on November 1st, goes through January 15th for this year. What were to happen if Congress were to, by the end of the year, say in December, while open enrollment's already open, expand the tax credits? Have you had discussions with any of your members on how that might work?
We have not had detailed discussions over that exact timeline, Senator, but I can share, as of right now, the change occurring this late in the process, as was noted by the folks that testified from DIFS earlier, final publication of rates are due on November 1st, right? So any change between now and then is still very difficult, but could occur, and certainly our members, all the plans that have decided to stay on the market, would do what they can to educate potential enrollees, either existing or future, as to what those premium costs will be. There is still time. I worry as we get later into the year, though, that window will close.
I mean, as I've watched the federal conversation occur, I think we've seen a lot of people that have said, well, we can kick this can down the road and we can deal with it later on. As you noted, we're already at a difficult point to have that conversation, but it only gets worse.
Yes.
The longer this goes. Any other questions from committee members? Seeing none? Oh, Senator Chair.
My light's not going on. There we go. Thank you, Chair. Appreciate the testimony and had a chance to read through some of the materials that you sent out before committee. One of the options that I guess you guys put forward as a recommendation, the basic health program. Can you talk a little bit about how that works in other states that have done it and what that might look like in Michigan?
Yeah, there's a few ways that in which it could be done that other states have explored. I mentioned Oregon, Massachusetts, and New York as some states that have gone down this path in their own unique ways. But at a high level, if I can try to summarize their activities here and what that might look like in Michigan, it's creating new products that are very similar to the coverage for Medicaid itself. Some states are doing Medicaid buy-ins where you are actually buying into managed care Medicaid products. So the product design itself would be similar to or could mirror, even be identical to the Medicaid core benefit structure. And then from a cost perspective, this creates an affordability level. Usually in states, they're limiting people based on federal poverty limits. I think New York goes up to 250% of federal poverty. So those above the expansion population, but still under 250% in the New York example, could qualify for this benefit. It's usually not done as an open-ended, anyone can buy in type of a benefit. So there's a few variances there on what Michigan could consider. And again, a lot of discussion would need to be had, a lot of work with the good folks at DIFS and MDHHS around the Medicaid program itself, if it were to be a buy-in option versus a individual market that is designed like a Medicaid benefit.
All right, thank you very much. Appreciate the information. Next, I will call up Rachel Richards, Jill Murphy, and Diane Holland from the Michigan League for Public Policy. Thank you for being here. Please begin when you're ready.
Good afternoon, Chair Hertel, members of the Senate Health Policy Committee. I am Rachel Richards. I'm the Fiscal Policy and Government Relations Director for the Michigan League for Public Policy. And I really want to thank you for having us here to testify in this really important issue. We echo a lot of the concerns that have been voiced by the folks at DIFS and the health plans, but I also want to provide a little bit of the more human context to this conversation. You know, in Michigan, more than 484,000 benefit from a health care tax credit in order to afford their health care on the marketplace. The lack of extension of these enhanced premium tax credits are going to have an impact on not only the quality of care that folks can purchase on the exchange, but also the number of families who will purchase coverage through the exchange. As we've heard, a 60-year-old Michigan couple that's making roughly $82,000 a year would see their annual premiums increase from just shy of $7,000 a year to more than $20,000 a year. So this is going to, their health care will now take up about a quarter of their annual income. We've also, in a single person, mid-40s, making $31,000 a year, their health insurance premium will go up by about $1,300 a year. So this will have a significant impact on the costs that families are expected to pay, and this is especially important at a time when they're really, we're also seeing the rates of health insurance just increase generally. So families that are losing the enhanced premium tax credits will really see a double whammy in terms of the hit that they'll receive come November 1st. I also want to say that it's important to note that the HR 1 also eliminated automatic re-enrollment for Marketplace enrollees, and this is a practice that 54% of Marketplace users leveraged in 2025. So in addition to the impact that the EPTCs will have, we're likely to see about 700,000 Americans lose coverage by 2034 because of that provision alone. So going back to the EPTCs, the Urban Institute recently did an analysis where they determined that about over 100,000 Michigan residents would lose their subsidized coverage, and about 64,000 would ultimately end up going uninsured because they could no longer afford their health care. And then to a point that was, I think, Senator Cherry was trying to make, with November, or maybe it was you, Chair Hertel, but with the November 1st deadline coming up, when the marketplace opens, this is when folks will really kind of start window shopping in terms of their coverage. And our big concern is that if Congress doesn't act and extend the enhanced premium tax credits, people are going to look once and they're not going to come back. And so even if Congress does something, say in December, when they, say we have more time to do this, I think there will be a lot of families that ultimately get caught up in that, like I said, we'll check once, we'll see what their rate is, we'll see what their tax credit is, and then we'll ultimately not go back. And we'll just increase that number of folks who are going without insurance. And then therefore we'll have this huge impact on our healthcare system in total. So I'm happy to answer questions. I'm also happy to answer questions once our guests also testify.
Hello and good afternoon. Thank you for the opportunity to speak to the committee today. My name is Jill Murphy, she, hers, and I live in Macomb County. I recently transitioned off Medicaid because I now have a job that offers a small healthcare stipend. I'm grateful for that. But moving to an Affordable Care Act marketplace plan was anything but simple. Signing up for healthcare coverage in this country has become a full-time job in itself, especially following burdensome requirements put in place this summer. Between endless phone calls, confusing forms, and websites that crash or contradict each other, it feels like the system is designed to make it as hard as possible to get the coverage that people need. I spent hours on the phone with the Affordable Care Act representatives trying to figure out which plan could actually cover what I truly need. Treatments for endometriosis, hormone therapy, replacement therapy for my perimenopause, and medications that help manage my neurodivergence. Then came the daily calls with my doctors, insurance companies, and Walgreens Alliance just to make sure my prescriptions were filled completely and correctly. I already work a full-time job to afford this coverage. I shouldn't have to work another full-time job just to secure this package, healthcare. And after all that effort, I still live with constant uncertainty. Every year, I don't know if my plan will still exist, if my medications will still be covered, or if premiums will skyrocket again. That kind of instability creates a cloud of stress hanging over households across Michigan and across the country. Families are trying to budget, plan for the future, and take care of their health. But when prices shift and coverage rules change without warning, it's impossible to feel secure. Even now with coverage, I feel impossible choices. Some months it's between affording prescriptions and keeping the lights on. And I'm just one person. What about the people who don't have jobs with healthcare stipends? I've asked my Congressman, John James, that same question, and I'm still waiting for an answer. Without the advanced premium tax credit, people like me will fall through the cracks. The pain I live with from the untreated conditions is unbearable. It affects my ability to work, to function, to live with dignity. So I ask those of you here today, especially those with spouses, children, family, or friends, do you want them to face this burdensome process? Or do you want them to encounter this impossible system when they need the care but can't afford it? Because they will. We all deserve access to care, not just those lucky enough to navigate a broken system or afford to pay what it demands. The advanced premium tax credits are what make coverage possible for me and millions of others. They're the difference between being able to go to the doctor or putting it off until it becomes an emergency. They turn coverage from something theoretical into something real and affordable. Without these tax credits, premiums would jump hundreds of dollars a month, more than many families can absorb. For me, these credits aren't just a line on a tax form. They are a lifeline that keeps me insured, keeps me healthy, and keeps me working. Thank you for your time this afternoon.
Thank you for allowing me to speak. My name is Diane Holland. I live in Okemos. I was a teacher in California until 2015. I had employer insurance. In 2011, I was diagnosed with MS. In 2015, I had to resign from my district, and I moved back to Michigan. I was smart enough to pay for disability insurance policy, which allowed me to pay for the 18 months of COBRA. I'm sorry. During that time, I was approved for disability retirement from CalSTRS. The ACA became my saver of health insurance in January 2017. Without ACA, I would not have any coverage. The premium tax credits helped reduce my monthly premium. The last 5 years, my Blue Cross Blue Shield policy was the cheapest bronze policy I could get. And at this time, I think it's at $8,500 annual deductible. So when that reaches, I don't have anything out of the pocket. With Enhanced, it lowered the monthly even more. On top of MS, I was treated for breast cancer at Sparrow during COVID. My 5 years of being clean is now done. The ACA with premium tax credits or enhanced subsidies allowed me, even with my high deductible, this year, once again, the people of Michigan, as well as the United States, are being pushed aside. Our well-being is being ignored. Billionaires get tax breaks. Common people get debts and no common aid. Congress needs to listen to the people. ACA and enhanced subsidies help all the common people in the United States. All those with ACA and employer health premiums has gone up. Our lives matter. All lives matter. November 1st comes at a dread for us. I use the AI to help plan how much I will have to pay. Anxiety is well known in chronic diseases. Why is Congress and the Senate playing games with our lives? This madness needs to end. Listen to the people. Thank you for your time.
Thank you for being here with us today and talking about the real-life impact that these decisions have and will impact you if not taken action on at the federal level. So really appreciate you sharing your story with us today. Do we have any questions from committee members? Seeing none, thank you for being here. Next, I will bring up Dr. Farhan Bhatti, Dr. Cheryl Huckins, and Dr. Simon Begg, all with the Committee to Protect Healthcare.
Good afternoon. Thank you. Thank you, Chair Hertel and all the committee members for the opportunity for us to testify today. My name is Dr. Farhan Bhatti, and I'm the CEO of Carefree Medical here in Lansing. I'm also the Michigan lead for the Committee to Protect Healthcare. At Carefree Medical, we take care of people of all ages, from the cradle to old age and everyone in between. These are people in our community who may otherwise have a difficult time accessing the health care they need to stay healthy. Many of my patients have Medicaid and Medicare for their health coverage, but many of my patients also have insurance through the ACA marketplace. And to afford those, they rely on these enhanced premium tax credits. These patients aren't alone. Since these tax credits were expanded in 2021, ACA marketplace enrollment has more than doubled. And now 24 million Americans rely on them. But they're set to expire at the end of the year, and if they do, premiums for families will rise by an average of 75% or more. In rural areas, like many parts of the congressional district that I live in, premiums could rise more, as much as 90%. These huge increases could result in 4 million Americans losing coverage. In this congressional district, that's 8,600 people, many of whom are my patients. For the people who are able to maintain their coverage, they'll have some tough financial decisions to make, as we just heard. 23,000 people in Michigan's 7th Congressional District will see their health care costs rise if the ACA tax credits expire. For a family of 4 earning $64,000 a year, their annual premiums could rise by $2,571. That's a lot of money, especially as groceries, housing, and pretty much everything else continue to become more expensive. I worry that many families will stop seeking the care that they need. I worry that my patients will stop seeking the care that they need. With more and more patients losing their insurance, it will get increasingly difficult for my clinic to stay afloat too, and that has yet to be touched on today. As a federally qualified health center, or an FQHC, my clinic is eligible to receive enhanced reimbursement for every patient who's insured through Medicaid and Medicare. But what many people do not know is that FQHCs do not receive any additional reimbursement for individuals who are uninsured. Therefore, as the percentage of uninsured patients increases, our revenue decreases, making it that much harder for clinics like mine to keep our doors open and serve the community. Between federal Medicaid cuts and the potential expiration of the enhanced premium tax credits, we are headed for a healthcare catastrophe in our country. Though you certainly do have my gratitude, all of you, for preserving Medicaid funding here in Michigan for the upcoming fiscal year. Thank you for doing that. And just like it was so important to preserve Medicaid funding at its current levels in order to safeguard the health and well-being of my patients who are insured through Medicaid, it is also important to preserve these tax credits so that people can keep their health insurance and avoid preventable suffering and preventable deaths. This is why I urge all of you to support the passage of Senate Resolution 81, which urges Congress to permanently extend the ACA tax credits. Thank you again for the opportunity to be here today.
Thank you, Chairman Hertel, Vice Chair Weber, and committee members for allowing me to speak today. Good afternoon. I am Cheryl Huckins. I am a primary care internist and a nursing home doctor for the past 43 years. I am also the past president of the Michigan Medical Directors Association, now known as PALT Medicine Michigan, which is the Society for Professionals Working in Skilled Nursing Care and Assisted Living. Many of our residents in the nursing home actually buy insurance through the ACA marketplace. Simply put, the enhanced premium tax credits make it possible for these people to get their care each month. You've already heard how many people have purchased this year and what the experience would be for a 60-year-old couple. That $85,000 total income, $22,600 would go toward their health care premium if those tax credits expire. As was said earlier, that's 1/4 of their total income. And that does not include the deductibles, which on the bronze plans can be $7,000, and what we just heard may even be up to $8,000. Imagine spending $30,000 on health insurance before coverage even begins. Many of our direct care workers in the nursing home also buy their insurance on the ACA marketplace. They have an average salary of $35,000 a year, so are going to be at high risk of being priced out of health insurance if those expanded tax credits go away. When they don't have health insurance, as was said by others, they won't go to the doctor unless absolutely necessary. They will come to work sick and bring their infection into the nursing home. They also can't manage their chronic disease like diabetes and asthma, and therefore they're going to have more sick days. As you all know on this committee, we already have a workplace crisis with our workforce in nursing homes in this state. I also work at Hope Clinic, which is a faith-based center in Southeast Michigan that provides free care for those who do not have any other insurance. We now take care of 3,100 people, but before the ACA, it was 7,000. Most of our patients had jobs. I remember a self-employed plumber, a substitute teacher, working full-time, but did not have insurance benefits through their employer and could not provide, did not have the money to buy their own. One of them was a janitor at the hospital that I worked at who could not afford the part of the premium that the hospital offered for their health insurance. I have memories of seeing patients lined up out the front door, and I still feel guilty that we could not see everybody and we had to turn people away. Those patients all went away when the ACA was passed because they now had the ability and had insurance and no longer qualified for coming to Hope Clinic. With the recent Medicaid cuts, Hope Clinic is expecting an immediate 11% increase in our patient population. If these expanded premium tax credits expire, those numbers will balloon. Hope Clinic does not know how it's going to be able to schedule all those patients for care. And what will happen is that they will go to the emergency room, which is the most expensive form of health care we have. We know that it increases the cost for all of us because health centers will spread their medical losses across all the patients that come in. It makes no financial sense not to extend these health credits, these tax credits. For these reasons, I also support passing Senate Resolution 81, which will urge Congress and the President to permanently extend these enhanced tax credits. Thank you for the opportunity to share my thoughts with you, and I would be delighted to act as a resource for you and the committee as you continue your deliberations.
Good afternoon. Thank you so much for the opportunity to come here and testify. I am Simi Bey. I am a hospice palliative care, internal medicine, and lifestyle medicine physician. I oversee a hospice and palliative care practice in Grand Rapids. I'm not going to go into the statistics that I know you all have been hearing over and over, other than just a little reminder that many of our patients, they purchase their health care through the exchange, as you all have heard. And if this premium tax credit goes away, we will have an increased number of patients who will not have coverage and therefore limiting the access to health care. Access to health care is already a big issue, even as it currently stands. We know that with these tax credits going away, the premiums can increase by 70%, even higher, again, as you've heard before. Budgets are already tight. I know, even for myself, it's hard. I am an educated physician with resources, and this worries me. I can't even imagine how my patients who don't have the resources that I do or you all do, how that's going to impact them. As a physician, I see the impact of the management of chronic disease, how important that is. Poor management of chronic disease is very costly to our healthcare system, and it requires consistent access to healthcare that our patients, my patients, your constituents, are likely to lose if this tax credit is not extended. I will share with you a story of a patient that I saw earlier this week, a 61-year-old woman who has diabetes, and she makes too much to qualify for any government-assisted programs. And because of that, she is relying on the health care, the tax credit that we all are considering eliminating. Her diabetes requires consistent oversight, visits to the physician, management of her blood sugars, education. But because she's not able to have access to health care, she had complications. It caused peripheral vascular disease, which caused wounds to become infected, and the infection spread into her bones, and she had to have an amputation. This is one patient who has suffered morbidity that is only going to increase because of lack of access to health care. If we look at the impact that it has on our patients, it doesn't feel right. It's not the right thing to do. But even if we forget that for a moment, it is very costly to our healthcare system. These patients will utilize the ED with increased visits and increased hospitalizations and increased length of stay in the hospital. Again, very costly for our healthcare system. By eliminating the tax credit, the health disparities that we are seeing already increasing are going to become enormous, and I worry that they will not be able to be equalized in the generations to come. This is a critical issue. But the thing is, it doesn't have to be this way. We have an opportunity to change the outcome. So I urge you that you can pass the Senate Resolution 81 so that we can urge our congressmen as well as our president to permanently extend the tax credit and really save our vulnerable and marginalized community from becoming more vulnerable for generations to come. Thank you for the opportunity to speak today.
Thank you very much for your testimony. Do we have any questions from committee members? Seeing none, thank you. I want to thank I do have one card here. In support of Senate Resolution 81, not wishing to speak, Elizabeth Cutter from the Michigan Health and Hospital Association. I want to thank everybody for being here today, sharing your testimony, your expertise, your lived experiences with us and what this impact will mean for people all across the state of Michigan. I think as we're watching the federal discussion right now, there's a lot of rhetoric. And frankly, there's a lot of nonsense. But I think the reason we wanted to have this hearing today was to show the direct impact it will have on folks who are purchasing their plans on the exchange here in the state of Michigan, but also everybody else who is insured across the state or uninsured, and how it will impact their access to care. And I think as we look at the Medicaid cuts that we were thankfully able to protect against for the next budget year with the recently passed budget, I think it was a perfect example of how we can come together here in the state of Michigan and do our best to work against some of these impacts. But there's nothing we can do to stop what will happen right now from costs going up on Michigan families without Congress acting and renewing these tax credits. And so I look forward to future conversation on this resolution and on this issue. And again, thank you for everybody for being here for this hearing today. With no further action before the committee, we are adjourned.